Hello, I'm Tracy Turonis, registered nurse and resource coordinator of a cardiac cath lab in southwestern Arizona. I'm here to promote a culture change within the organization by instituting a new policy. This winter, past flu season, my role as resource coordinator was to offer flu vaccines to healthcare providers in the cath lab. I was surprised by the amount of providers who declined this preventative safeguard against the flu. Healthcare workers are at risk for exposure to serious and sometimes deadly diseases. Healthcare workers include physicians, nurses, emergency medical personnel, dental professionals and students, medical and nursing students, laboratory technicians, pharmacists, hospital volunteers, and administrative staff. Working directly with patients or handling material that could spread infection, healthcare providers should get the appropriate vaccines to reduce the chance of contracting and or spreading vaccine-preventable diseases. Every year, thousands of adults in the United States still suffer serious illnesses and are hospitalized and even die due to disease for which vaccines are available. In the U.S., vaccines have greatly reduced or eliminated many infectious diseases that once routinely killed or harmed many infants, children, and adults. However, the viruses and bacteria that cause vaccine-preventable disease and death still exist and can be passed on to people who are not protected by immunizations. Each year, an average of 226,000 people are hospitalized due to influenza, and between 3,000 and 49,000 people die of influenza and its complications, the majority among adults. Vaccines are very safe. They are tested and monitored before being licensed by the Food and Drug Administration, FDA. Both the Centers for Disease, CDC, and FDA continue to monitor vaccines after they are licensed. We will judge our outcomes two ways. First, by recording how many healthcare providers accept the vaccine, and second, by monitoring and comparing self-sick call-ins with flu-like symptoms from October to March this year and the previous year. The expected outcomes will include decreased self-sick call-ins and a decrease in hospital-acquired infections. The proposed policy is every healthcare provider will receive a flu vaccine. If the healthcare provider objects, they must provide documentation from a healthcare professional of why they are exempt from this policy. Protecting patients, family members, and fellow healthcare providers from disease that are preventable should be a top priority. Thank you.